Okay, we're gonna get started. We're gonna open this meeting up at 6:02 p.m. And we will start with public comment. We have one person, including virtual and in person here. Jen, you'll have other opportunities, by the way.
All right, well, I do have a couple of announcements. So I'm Jen Boucher-Danzer, Executive Director of Yolo County. And I just wanted to announce a few things we have coming up. On Tuesday, May 7th, we will be having a lunch and learn presentation for Tardive Dyskinesia Awareness Week. So that'll be on Zoom, and I'll send you the Zoom link and information on that as soon as we've got that together. So that'll be at noon on June 7th. Sorry, May 7th. Apparently it's May this month. May 9th, we are having our annual Celebrate Hope and Resilience fundraiser at the Onoxero Country Club with a luncheon this year in Davis. Tickets are sold out, but we have a waiting list, and we are expecting to be able to open up a few more tickets over the next several days. And then next event actually is in June. On June 11th, we will be having a kickoff party for our NAMI Walks, Yolo County, which will be held this year on September 28th, again at the Movie Village.
I'm sorry, I didn't know.
Oh, no worries. It's all good.
Okay, thank you, Jen.
Yes, as a matter of fact, Big Day of Giving is tomorrow. It's a busy week for Big Day of Giving. We had a little mini crisis. We have lost access for several weeks to our Facebook page. Because apparently, we have NAMI in our name, and there is a NAMI Facebook page, and we often share their content. We were flagged as a fake page, so spent weeks getting that restored, and did not think we would have it done in time for Big Day of Giving, but just got it back late last week. So we are officially promoting Big Day of Giving on all of our social media channels. But it is a big day for all nonprofits in the Sacramento region. So think of who you're going to bestow your charitable gifts to tomorrow, and get online and make your donations.
In fact, it starts at midnight tonight, so for the night owls.
Exactly.
You can beat the rush by getting online at 12:01 and making your donations.
All right, thank you, Jen. And approval of the agenda. Is there a motion to approve the agenda? So moved. Chris moves, second. Second, Rita. All in favor, say aye.
Aye.
Opposed? Abstentions? None? Okay, item 3, approval of the minutes. Can I get a motion to approve, or are there any changes to the minutes? By the way, Sue and Maria spent a lot of time. The minutes are really detailed, and that's really hard. But Maria and Sue spend time kind of tweaking and making sure they're correct. Yeah, I appreciate that. I appreciate that. So they've looked at them. Are there any changes anyone thinks need to be made? No? Okay. Motion, please. So move, Chris.
Brad, okay.
Second from Brad. All in favor, say aye.
Aye.
Opposed? Abstentions? No. Member announcements. All right, seeing none, chair report. So it's about that time to select, vote on new officers. I'm not sure where Maria and Sue are at. I'm more than happy to pass the baton to someone else. So I have no stake in being chair, and so I'd like to see if we could get a little ad hoc committee to kind of work on, figuring out recommendations for our officers for next year.
Are you running for chairman?
No, I mean, I suppose, here's the way I would put it, if no one wanted it, I'd consider doing it, but I don't want someone to not decide to do it because they think I want to do it. If someone wants to do it, they should do it.
Nikki, you just had it, did you?
I sure did. I served my time and I had a parole.
So I'm just looking for a couple of green people to do.
Everybody should pay what they do.
Thank you. Just contact people, or you could ask, or people, if people can contact you. With their, you can contact people that you think might be interested. People here, if they know the committees, can contact you and say they are interested.
I have a question.
Yes,
I don't know how to contact anybody in here. I don't have a phone.
I'll make sure you get the contact information.
Yeah.
I'll resend it out, you bet.
Did I miss it?
All right.
It was a long time ago. Yeah, we just did updates a long time.
Joe is our chair.
That's perfect. For an ad hoc committee.
Yes.
Of the ad hoc committee.
Yeah, let's be clear.
I'm gonna appoint Joe as our
Let
chair.
me be clear, I'm not running for chair right now. I'm ad hoc committee.
Okay, who's gonna,
So you guys help, anybody help call on people? Well, we gotta split that up.
we got Joe as chair, we got Meg, one or more.
Wait,
Can I
I'll
just-
see, he's signing up for the ad hoc.
I'll help them contact people.
Yeah,
Okay.
these people are just signing up for the ad hoc.
Right, right. We just, yeah.
I don't think Joe was signing up for chair.
No, I was just joking.
No, I
You wouldn't mind doing it,
no, I appointed him chair of the ad hoc.
please. Shall we nominate folks that aren't here?
Yeah, so we got,
I'll nominate Dee.
yeah,
That's always a risky strategy.
no, she's gonna be great. So we got Joe leading the charge, if that's okay.
That's fine.
And then we got Meg, John, and Dee. That's perfect.
Brad, it sounds like you might be interested too. Are you interested
Me?
in being on the ad hoc?
Oh, up to you, don't feel pressure.
I'll be fine. I guess I was hoping still to be able to contact anybody in here if I need.
You can work behind the scenes. Okay. Next item, and that's the only. That's the only. Announcement I have. All right, correspondence, any correspondence?
None.
None. Follow-up discussions on setting board priorities. Did you all see, in the packet?
It's in the very back page.
Brandy put this together with Carlene. Carlene, you added the presenters, right? Is that what you added those, right?
Sorry?
Or did she have those on that little? That little chart? Did she put in those presenters or did you?
I think that
You did?
you probably,
Okay,
yeah.
all right. So,
This is just suggestions, let's.
Yeah.
That was just initial
Yeah.
brainstorming, yeah.
so, and so Carlene and I have spoken, I think the plan now is, one of the things we want to do is put together a calendar, which we haven't had for a few years, and the calendar will have all the dates where we need things to be done. And then we're gonna want presentations on, some of these, the top 7 issues, which I think will be not that difficult to do, and so we'll add those to the calendar. What else, Carlene?
Yeah, so more of a long range planning calendar. There are some standing items from HHSA that we think should be brought to this board regularly, annually. Things like, budget updates. We know that we have regular, timelines for our MHSA processes, so we can build that into long range planning. and then the requirements, the deliverables of the local mental health board, so the data notebook and the annual report. And so, what Jonathan and I, and Maria and Sue all talked about was really building out the structure of the long range planning calendar with the requirements first, right? And building out those structures of the things that need to be completed by this board. And then that will give you a good sense of where then there is opportunity, right, to fill in with presentations, topics, study sessions, things that you're interested in, and then that, I think, where these top priority topic areas really then can kind of come into play. And where you can determine how you like to fill those in your calendar year, and and then even the activity of setting priorities for the next year, right? So building that all into a long range planning calendar that then is easy to carry on year after year. It's a great tool for the incoming chair to have, right? So it doesn't feel like you're having to recreate the wheel. And then a lot of the items that we'd be bringing to you from HHSA help fulfill some of the information gathering that this board needs to do an annual report, or to have a good sense of what some of the needs are in the county. So things like the findings from our external quality review, the recommendations from our external quality review, or things related to our budget outcomes, things like that. So so that's some of what we talked about. So Christina and I will work on that in terms of the deliverables for the local mental health board, and then some of the county pieces that I think we can offer. And we'll bring that back to Jonathan to bring to them.
Yes.
Relative to the list, should we have public guardian in here? That's
Um,
one of our ongoing.
Well, it wasn't something, this all came from our.
Yeah, I know, but we had just had a presentation at our last meeting on public guardians, so.
We have SB 43 on there, which
Yeah,
involves the public guardian
Yeah.
in the expansion. And maybe we put that together, because I think that that change in the law is something to follow, that it would really be helpful for a specific population that isn't being conserved right now, especially some that are with co-occurring disorders that are criminal justice involved, where that might be prevented.
Yeah,
And making sure the public guardian has enough resources to actually implement that is a big part of ICSD 43.
I agree with that wholeheartedly. I just, I want us to be mindful about having that as an ongoing responsibility and area of concern. Because these are the most vulnerable people we've got in county. And it seems to me that, say SB 43, if somebody else looked at that, they would make, as I did, the public guardian connection. So I just think it probably ought to be a priority.
well, and I feel like it is, and maybe it didn't come on there because we just had the presentation, but then we'll be updating this every year, and I feel like every year, I agree with you, maybe the public guardian should be something, in my opinion, that it's a priority.
Did SB 43 include the care plan? Is that also?
No,
Is that also a piece of this, right?
yeah, I mean, SB 43 is not cared for.
But.
But that's probably gonna be something ongoing that we're gonna hear lots of updates on. It's always on the mental health directors. It will be part of
But
every,
yeah, I just don't know how care court can function without the guardian's office either. I just feel like the
Yes,
public
it is-
guardian
it is. it is related. Or I'm trying to think.
I don't know, people in care court wouldn't be on conservatorship.
But wait,
What is it all?
but is at one point, I'm trying to remember now,
If they
the
don't,
bill,
if-
if they don't, there can be a referral.
it becomes potentially a pathway, right, to a
Correct.
referral for a conservatorship investigation, but. So there's a connection, right, to
Connection.
conservatorship investigation. But yeah, I mean, it is a civil court process.
Most of the people who are on the conservatorship, not all, but some,
But yeah, care plan, someone who's on a care plan wouldn't be
are
conserved, that's a separate process.
No, I guess maybe I don't understand care court then. I thought that.
Perhaps that would be a good.
Yeah, I thought that a judge might mandate something, and I don't know if the judge mandating it means that they have to have somebody overseeing it like a guardian, or.
Well, they would maybe a care plan, but they wouldn't be under conservative.
They would be under
Yeah,
conservatorship.
yeah, yeah.
For care court, if they completely for lack of a better term, fail out, I don't use the term, but could be a referral after everything else fails to the service and investigation. That's the way it's, in the statute. That's like,
Yeah, I can make a note that I can do an overview of the report process for my next mental health director's report, and I'll link to some additional resources.
Yeah, I think to understand how everybody can enter the system and all that.
Yeah,
I would emphasize public guardian also because we spent actually two meetings talking about it. And it seemed like people were pretty passionate about it, so. I would say that public guardian is a pretty important thing, not that I would totally want to put it off from it.
Yeah, and to the extent that this is both a document that we're gonna, a working document. If we were gonna share these priorities with someone, I think they would wonder what was happening on public authority. So this,
I am glad 5150 is number one.
yeah, 5150 is really important.
so would we want 3, maybe just change it, like for the document to SB 43 / or implementation / public guardian?
Just relabel it.
I mean,
At least it would be on our.
I think start with public guardian and then investigate for the implementation.
can we do that? You know?
Yep.
Right. All right, so,
Jonathan, just to decide.
yeah, thanks.
This is Steve here, but regarding the funding for the board, for the June budget, and I realize that the guardian doesn't have money to do what they do now. And then having SB 43 is just a killer. So this board would be able to weigh in with a recommendation. Get up to that next meeting, but I'm still looking for our budget.
That makes sense.
Yes,
Yeah.
so I think, I feel like we did weigh in the last meeting that I was at. but
Did we
so,
write a letter?
yes, we did, we did, we wrote a letter, I presented at the board of supervisors meeting. And Supervisor Potenza is one of the strongest supporters, I feel, of making sure the public guardian gets it's sufficient funding, not only for what it does now, where they don't have sufficient funding, but moving forward, where they're gonna have so much more on the plate. What would you recommend that we do to
Advocate specific.
like show up at the meeting?
The letter, and yeah, you can show up and get with a specific, right now, it looks like, just listening to testimony, I may be wrong, but it sounded like we need twice the number of deputy. Deputies, that be accurate?
Probably twice the number that we have now. You mean to do what we're doing now and to do what we're gonna have to do moving forward, or is it more than that?
no, yeah, I think the request that we put in for, was for 2 additional, if I'm remembering correctly. And that's actually just for our current caseloads. It's not in preparation for SB 43. There's additional analysis we have to do locally around what our projected caseload increases would be to determine, and we wouldn't be seeing those caseloads increase until the following fiscal year, so we wouldn't be requesting those positions in this budget year. So that there would likely be additional positions needed next fiscal year. So yeah, I think there's a sort of ramp up approach, right, to getting that program better staffed in preparation for SB 43. So we've got 2 positions that have been,
2,
Yeah.
I was thinking 3, but
yes, I think there were 3, but then 2
Yeah.
were moved forward.
So-
That's my understanding.
So
but-
once,
so I think just supporting, but
yeah, when's that, what meeting is that, what date?
that'll be, June, there's gonna be a meeting where we discuss public guardian, which is coming up, I think. Just generally report back, and then it will be voted on in June budget, so we'll get that to you. I mean, could get that to you as to what meeting is coming up,
Well, my understanding is that there was a budget presentation at the May 7th meeting. And if we're doing some additional follow-up at the request of the county administrator's office with some data around comparable counties with comparable counties that we use for class and compensation. comparison, so there's specific data that we're looking at, caseload, staffing, things like that, so our team's working on gathering that data, and then we'll figure out how to.
So,
We will not, that's not, we've not been asked to have that by May 7th, so I'm not sure, yeah, we're
yeah,
still
once
working
you
on that.
know,
Yes, so we're still working on that piece, I'm not sure when the CA is expecting that.
So my question is, I just, will this board have another meeting before we need to get input? Because I feel like this board needs to vote as to what we're gonna do. And so if the meeting, if the critical meeting is after our next meeting, then that's not gonna be a problem. So
it's like double know for sure. Our budget, the budget would be middle of June.
it's middle of June. And if that's the case, then we'll have a meeting in June.
Yeah, and I just want to be, when it's presented to us, I would push for something at that point too. You have weighed in already, so when the budget request comes in, if we haven't already said yes as a board, then.
Okay, so here's my suggestion.
Will we be able to get a presentation from Carleen on the data she's acquiring from other counties at our next meeting that we might be able to use at the board meeting?
I mean, we'd be happy to bring some data back to this board if that's the request. I'm not sure that the data we're collecting for the county administration, I'm not sure what the intent is from our CAO around the data he's requested. I'm not sure if he's planning on that data going back to the full board. I would need to follow up with our agency director.
So I guess the question, if we get that.
But we certainly could bring the
Here,
data back here.
We had the ability to do public comment, would we be able to use that data in the public comment at the budget meeting? Or would that be a problem?
Oh, no, I'm not worried about the data being, yeah, so I believe that we can prepare a follow-up presentation for this board, whether it's, in my report and then it gets pulled and we can discuss it, or we put it on the agenda as an item where we can provide some of the data that we've collected from other counties for comparison. If that's the request of this board, we're happy to share that. I'm just not sure what the plan is in terms of the board of supervisors and our county administrator's office. I can't.
So here's my thought. So for May 7th, so I just got an email from Chair Barrett's deputy, Tara, that there's going to be some sort of resolution and they wanted a representative from our board there on May 7th. And I said I would be there. So I'll be there. Since I'm going to be there anyway, and we've already voted on support of more funding. I might make a public comment from the board, on behalf of the board, about more funding. Then, once we get more information at our June meeting, we can agendize it to have a discussion and a vote on what this board would like to do at that June budget meeting with the board of supervisors. And either myself or someone else on this board can make a comment on behalf of the board at that time to support the funding. Sound good? Okay. All right. Item 8, bylaws discussion. So we're going to have some bylaws changes, as all of you know, due to Prop 1, which will be the makeup of the board, in terms of having someone who's representative of the transition age youth, and also a representative who's a employee of the local school district, I think. And so we're working on, that doesn't become effective till January 1st of next year. But in the meantime, we're still working on our other amendments. And one of the issues that has come up, and we had Teresa from our state agency talk about, our committees, because currently we have 3 standing committees. And I know there's been a lot of discussion about whether we need the 3 standing committees, which require us to adhere to the Brown Act, which makes it a little bit challenging to do that. And the question is whether we want to have 3 standing committees, or whether some of those standing committees should be ad hoc committees that don't have to adhere to the Brown Act. So Maria's gonna, did I tee that up a bit enough for you? You talk about the issue And then I'd like to have some discussion, and then if people want a motion to change the bylaws, we can entertain that, and if we want to keep the bylaws as is, that's fine too.
And really for the discussion, I just took exactly what was in the bylaws, and so I just wanted to refresh for everyone what it says. And then just briefly talk about the Brown Act and how it impacts like what we should be doing in these standing committees. And really that, the rest would be discussion. Does that make sense? Okay. So, verbatim from our bylaws, there are 3 standing committees, the board appointed by the board chair. Purpose of the standing committees shall be to assist and support the board by carrying out specific tasks assigned as needed by the board chair or by the board. The committee cannot take a formal action on behalf of the board without prior authorization of the board. All LMH board members are welcome and encouraged to attend subcommittee meetings. The standing committees are budget and finance. The Budget and Finance Committee shall provide leadership to the board by reviewing and reporting on legislative proposals, consider budget and funding issues for mental health in Yolo County, and ensuring all advisory functions of the board are carried out. Communication and education. The Communications and Education Committee shall provide leadership by assisting the board to inform on the public mental health issues in Yolo County, developing education opportunities for the board, and coordinating the development of the board's annual report required by the Health Welfare Code and Yolo County ordinance. Just a note on there, it does not mention the NOPA. Program Committee. The Program Committee shall provide leadership to the board on the review and evaluation of Yolo County mental health needs, facilities, services, and special programs required welfare and institution codes in Yolo County ordinance. The chair of each of the 3 committees shall serve on the executive committee board. Some of the items that we need to make sure that we're adhering to is Brown Act. The posting of the agenda 72 hours before the meeting. Christina will usually help with the posting, but we do need to make sure that she has the agenda 72 hours before. Our meetings do need to be in person. So whatever board is meeting, that has to be in person with the ability to allow public comment via Zoom. So we have to make sure that we're reserving appropriate rooms for that purpose. In addition, no decisions or opinions to influence consensus can occur outside the meeting. This includes conversations, emails, or informal meetings. So if you send out communication or text, you should not be asking for opinions or any kind of input with regards to what you're sending out. That has to be done within the meeting. So with that, we also had Teresa who came to our board. She added some additional detail in terms of the budget that we should be asking for, as Carly mentioned, regular input from HSA. Emma, sorry, I'm always bad with acronyms. Thank you. Anyhow, so we should be getting that information on a regular basis anyways. In addition, we do need to make sure as a board that we are paying attention to having our annual report and notebook, which is not mentioned in our communications and education. She also mentioned that some of these things can come up on an ad hoc basis, and we should be able to contribute. Ad hoc meetings can be done by Zoom. For the program committee, I'm not going to go too deep into that because I know we have representatives here who can speak more to what's been occurring and that piece. So that was the information for this discussion.
Can I ask you a question?
Sure.
So were we wrong to send out question show what the questions we were going to have for site visits and ask about that? Was that?
So
not
I am not an attorney, so I can't speak legally what you, but my understanding, and you are an attorney, and you are an attorney. I don't know if it was there, but my understanding is you can send out information, but you cannot ask for input.
I think I mean, it's President is certainly nice promise, but issues that are going to become up for a vote, you know, those are the issues, like if there was something that was going to be voted on, you know, those are the issues that we can have not have discussion on with that committee, perhaps a full meeting that is noticed under the Brown Act.
So, less than majority.
Right.
Less than the majority of the ad hoc.
Yes,
Yeah, you have to be careful.
Well, that's what I mean, because I'm saying,
Yes, be careful. So I could talk to Jonathan today, forget, kind of, forget, and then talk to me tomorrow. And talk to him.
well, plus, I think we should make it really strict that we don't do that, because so D actually did respond. And what if I had accidentally responded, because I didn't know that it had to be a minority of the group? So I think that's somehow we should make it, it was great sending it out, but you probably should say. Mum's the word out.
Well, I, basically, when I sent it out, I wanted you to review it, but bring it back to the meeting with no steps.
Right,
Yeah.
but somebody,
Dee did share her opinion.
I have a question.
I do too.
go ahead.
Okay, let's take nominations as an ad hoc. committee. You are going to get people in nominations who are going to come forward and nominate themselves or nominate someone else or whatever. So does that mean there can be no discussion about the individuals?
So that's not a standing committee. it's-
Okay,
Yeah.
okay.
And it's not held to the same,
Oh,
it's
I
not
did
held
say
to the
that,
same.
I wanted to do the same.
It's the way things are right now. In the bylaws, we have to adhere to the Brown Act on that, so we can't make any kind of decisions. We have, without bringing it to the meeting first and to have a discussion on it, then doing it. But as an ad hoc, it would free us up to
Okay,
not have to announce it or
Okay.
put it out there.
Right.
And then still bring it back.
Right,
For
so bring it back
clarification.
for a recommendation.
Right, like what Dee did, you know, prior to, we discussed it, are these questions okay to put out? So still, I'm thinking that prior to us discussing this right now, what the standing committee does and the ad hoc committee does, because you said with the ad hoc committee on the what we're gonna do with the nominations. It's different from the standing.
that's right. And
I know.
Yeah, I was trying to get clarification.
I think just as far as productivity, I know working on the bylaws ad hoc committee, which should have been done 6 months ago, I think, but it's kind of gone on forever. That if we had to follow Brown Act rules, that would be a nightmare. And I think if we're looking at the annual report, which is, we want to get input and develop a product, if we have to follow Brown Act rules, to produce that, it's gonna be very challenging. If we have an ad hoc committee assigned to prepare that report, we'll be able to meet, communicate ongoing and develop that much more efficiently. And we're all volunteers here, and we all want to try and be productive with our time. And so the number of standing committees we have with 3 may be excessively burdensome, where we can delegate some of these tasks to an ad hoc committee to meet and get something done.
Do you want-
So I like the idea of that.
I do want to add one more thing, is Teresa did specify, if there is a group that is going to meet on a regular basis, it really should be a standing committee. But if it's something like, for instance, you know, I'm sorry, I took my glasses off, but like budget, you might be meeting a couple times a year specific to that, that could be more of an ad hoc. But if you are going to meet on a regular basis, is that accurate? It should be a standing committee?
Generally, yeah, I think with budget, I know the board does, we have our chair and vice chair, which changes each year, and so the topic is that year's budget, so it's not ongoing, you know, something that's gonna always be there, right? So you could do budget, but I would tell the kind of council in terms of how it's raised and how it's set up. So I.
Raise hands. Gotcha.
So I don't know, about you, but the issues I've seen, everyone could be helped by handled by ad hoc, and see anything that really needed a standing committee and regular meetings. I see these, and this is just my view, as problem-solving committees. I don't want them to filter information from staff down to me. I want them to be assigned those assignments by the board, specific narrow issues to bring back to us. So I think, and I agree with what you just said, I think standing committees prevents people from volunteering across committees, not everybody, but some of us. And we all kind of need to be specialists in all the different areas. I think ad hoc committees gives us the opportunity to look at a budget piece one time, and maybe once you're done with that, you may want to get involved with the communications committee or whatever it may be. But when if I'm on the budget committee, I'm not gonna have time to get involved in any of it. I think ad hoc committees addressing specific narrowly construed problems by the chair of the board is probably more appropriate. If anybody's seen an issue that really requires a standing committee, I'd like to hear about it. Key is to have a specific task to get time ad hoc, and your general time to come back. You will come back to the board with a recommendation by such and such a date. Now that can't change. It's to show that it's a temporary committee that's coming back to the board, as opposed to some committee that's going to sit there year after year looking at topics.
Yeah, I just wanted to add to what Chris said, because he said that it would be a problem to do the annual report. It's not, it would be, it was a problem to do the annual report. We weren't making any progress on the standing committee. So I would definitely say, even if we keep all the standing committees, that we need to move the annual report out to the communications committee and make sure that that's gonna happen.
Well, now I understand why budget and finance might have been appropriate, budget committee might have been appropriate at that time. Because I had just never heard of an ad hoc budget committee.
Well, the board of supervisors has set the precedent, and as our county council said, it's legal enough.
It's legal enough. Okay.
Sounds like a lawyer.
We talked about how do we get our work done, so it sounds like if there's things that need to get finished, work done, work product, that's a town process. It feels like the standing committees are an opportunity for our community to get involved outside of government part of it. So I think we have to be careful that we don't have something as part of the Brown Act, because that isn't, I mean, it seems to me that's where the community has an opportunity to be involved. Right. We don't maybe need to have all of these standing committees, but I do think maybe identifying where would we want community input? And then maybe building a standing committee around that, and everything that really needs a work product would be a committee.
I think you bring a good point, but I would say that not all of these, and I think we should look at maybe each standing committee separately and not necessarily collectively. But some of these items we should be talking about here at the board and allowing for public review. So, and this is the meeting that most public folks who are going to participate are going to look.
But I don't think that we've done, I think we have opportunity to communicate to the public. I think they're just the few people I talked to, they don't know really the extent and what our role is. And so is it that we aren't necessarily really understood what we do, and then more people participate? Well, and I don't know, I shouldn't have gone, but I just think that the Brown Act was created, I'm assuming, so the community would have a voice. Right. Something, and I'm concerned if we don't have anything in standing committee, I'm not sure that that's saying right now.
Do you see a topic or one of the standing committees that we should still remain?
I don't know, I mean, I think we could.
Let's go over the three that Nikki had a comment, and then maybe we can take one at a time.
Yeah. You know, and when I think about it now, I think one of the reasons I felt that the budget committee should be a standing committee is because we had such a firestorm a couple of 3 years ago about the MHSA budget. And lots of people wanted input in it, and they thought we were keeping it from them.
We thought,
Oh, so the comment was made by several people in NAMI that they didn't feel they had an adequate opportunity to voice their concerns about how the MHSA was going to be set up. And they had been on some of the community meetings in terms of developing the MHSA plan. And they didn't feel that it was aligned closely enough with the budget. So, I was really trying to figure out a way to keep confusion down as opposed to create more.
Vicky, is that when we did a special meeting? Didn't we do a special meeting to allow for more input?
Finally, that's how we
Right.
resolved it. That's right. But I'm just thinking there ought to be a way within the process, without having to have a special meeting, where people feel they have a chance to show up and say, I think you need to put more money into PEI, or you need to put more money into whatever category it is. Because they didn't feel heard.
Well, I mean, I sort of, and I totally get that, but I also feel like there's so many opportunities with the MHSA plan and all those meetings for people to give input, to give written input, and then they could come to any of our meetings.
Right, but the question wasn't about the plan itself, the question was about the crosswalk between the plan and the budget.
But I think that would make sense if people can hear the first on topics like that. I mean, I do think that would make sense.
Can I ask a question? So Charlie,
I think they would be.
how many listening sessions and collection of what occurs? Because I know you go to different areas to collect information. So how much of that is happening and is it targeted, like if it's the budget, like what is?
Yeah, that's a good question. I'd have to go and give you exact numbers on the number of community engagement work groups that we've held, but we, leading up, so, and it's a little bit different, so, because we do a lot more leading up to the creation of the 3-year plan than we do for the annual update, for example, right? Because the 3-year plan is, for all intents and purposes, a brand new 3-year plan, right? Where the annual updates are intended to be the opportunity to make, to make whatever investments we need to make for emerging issues or, to address changes we need to make so that we're not stuck with the same plan for 3 years if something's not working. And so, I believe they hold at least 4 virtual, community engagement work groups. But I know just I can speak to just this last annual update process. We held a community engagement work group listening session in each of the supervisorial districts in person. And they were also open in Zoom. And there was incredibly poor attendance, I will just say. I mean, besides Esparto, I came to every single one and, just to at least welcome. And oftentimes our staff outnumbered the number of people there. Although I will say for the 3-year plan, there was a lot of involvement. I think the other thing is that besides doing, I think, one in-person event in West Sacramento for the 3-year plan, this is the first time we've done in-person meetings since the pandemic, right? And so I think folks are pretty used to doing virtual engagement. We do a lot through the community engagement work group. So a lot of what we do is get feedback from the community about what the priorities are, what their needs are. And then there is, when we start to work on a draft, right, then we do bring sort of identified priorities to the group. We sort of feel that out and get feedback there. There's processes that we go through here, right? Bringing the actual formal draft plan here, then it gets posted for the 30-day public comment period. And then we take all those comments, we put them together, we provide responses to all of them, we come back here. This board holds the public hearing for that. We respond to any feedback then from the local mental health board before we finalize the plan. Final plan comes back here, and then it goes to the board for approval, the board of supervisors, right? So this board doesn't have to approve the plan, right? They review it, provide feedback on it, and then the board of supervisors ultimately reviews. So there's lots of opportunity. Now, in terms of how far in the weeds we get on the budget, I think it sort of depends. That really happens more in this meeting, I'd say, than in the QG meetings, the community engagement work group meetings. But it doesn't mean we couldn't get more into the budget in this meeting, right? I think it's just been the way that things have gone the last couple of years is that we've gone in more detail, I think, around the budget.
I think, well, the problem we had last time is trying to get the 3-year plan a little earlier so that we can look at it and give the stakeholders an opportunity to make public comment. So I think we extended it a little bit last time. That was the problem. And then getting the data back so that we can find out what the measures are. That was the other thing that we.
And Carly's, there was not.
There's an annual update due now. Yeah, so we're 1 year, we're in our first year of the 3-year plan. So there's an annual update. process. So like I said, we just did the listening sessions where we've had a lot of fiscal changes this year, an entirely transition of our county financial system, which has created some challenges. So we're still waiting for some fiscal information for actual and projections for next year. So we can't update the fiscal side of things yet in the budget. So our annual update will be delayed this year, but I committed to Jonathan to getting the information to this group with enough time to really review the documents. And that's something that has been challenging in the past, and it's something I've committed to. My first day as mental health director, which happened to be a local mental health board meeting, so and it's been a trial by fire ever since, but and so I'm holding to that commitment. So once it's ready, we'll make sure it comes here with plenty of time, for review and lots of opportunity for us to talk through it. I will say that that MHSA has been pretty volatile.
Yes.
Last year, our revenue was much lower than we anticipated, which is really problematic, but then we're expecting hopefully some upswings on some revenue, which will be great because we're having to spend down fund balance just to
Maintain.
right, to pay for the contracts, because we budgeted based on our projections. So anyway, it'll be an interesting, review to go through with you all once we have all that put together. But we're not gonna meet the July, we'll be beyond July this year, but that's just because of some of our fiscal challenges we've had.
All right, let's take them one at a time and discuss them, and then we can really get a motion to someone. Mentioned changing the bylaws, budget and finance. Any thoughts on that, in terms of whether it should be ad hoc, and remain standing? Okay. Let's,
One thing is really depend on how the budgeting is done. If you have on your you would need to have that committee return to this board
yes,
more frequently.
right,
Could be just not use the budget, but.
right, yeah, right. Okay, and anyone, just draw the vote, or anyone feel that budget should be standing? Thank you, guys.
And I'm only, and you know what? My experience could totally have been because of COVID. But I got my butt chewed on for months about the budget for that last 3 years, maybe that's 18 years.
Well, let's try it. If it's you anything. So
No, I'm done. I'm not the chair anymore. Let them chew on me.
We have an opportunity to revisit it and change it later if it doesn't work like that.
Yeah, sure, we could.
So I don't see, I think that was probably the reason why you had is because of COVID and the way
Yeah.
you were meeting.
So maybe we should take them one at a time. And do we have a motion to change bylaws so that the budget and finance committee, for now, at least test it out, is ad hoc, not stand?
I'll make that motion.
I'll second
But
it.
that it's ad hoc, right? It should just be that.
No, I'm sorry.
Yeah.
Thank you. That it's not a standing committee. We'll take it out of the bylaws as a standing committee. And Joe has made a motion.
I think what we should do is a motion for what standing committees will have at the end of the day, as opposed to which ones we're removing. So if we have only one, we're gonna keep the motion is, we have one standing committee, this is it. The others should be solved instead of doing. Moving them.
I'd also be curious the chairs of these committees, what their views are.
I was the chair of the budget.
Joe?
No, you're clear. I got that.
Okay. So. If we want to do one motion, I think I see where
Yeah. that
people are
makes
feeling
sense.
about budget. So we won't have a vote there. Let's go to communication and education. What about
So
that?
she's not here, but she did share that she was leaning towards ad hoc. Basically, what you said almost verbatim, with very specific targeted text, yes.
I agree. Probably that should make the,
Okay, so I'm just trying to get a feel for where we're discussion, and then we'll make a motion on all of them. And Chris, yeah.
Like made a point of there should be certain committee outreach and engagement that might be public. And that might be the only standing committee we might want to have, but what's included in that standing?
Are you talking
committee?
about the program?
You could have communications, education, some program, some combination, some of those topics. We have one standing committee that focuses on the public outreach component and getting feedback and then bringing it back to the board. What that standing committee looks like, I'm not the expert on that.
Be a combination.
But just because you're an ad hoc doesn't mean you can't, have input.
Can I make a recommendation? I think from what I'm hearing from all the comments, is we have not done as a board a good job, or maybe we're just learning, but I think we're
Managing.
right, managing the communication and publicizing when things are available. And so maybe what we need to do to add to our annual calendar is targeted periods where we actually publicize, whether we partner with NAMI or someone to get that word out. And then through that, we make sure that we're getting participation in public comment.
Yeah.
So I think at one of our last meetings when we were brainstorming, one of the ideas that came up was learning how to communicate with the board's information to the board and staff consistently throughout our different parts of the community, right? Because we all said it differently. So I think it was that very important to know that.
So maybe.
Yeah, we should really that.
Maybe there's an ad hoc committee that's created, maybe with some recommendation on this, that we shouldn't necessarily. Because that is an opportunity, you know, whether or not, and I don't, after thinking about it, I don't want to create a standing committee just to solve that, right?
Right.
That would not make sense.
Right.
But I do think we have to
Figure it out.
I think what we did before was work on navigation, a place where a person could go, a family member or person in crisis, to be able to go to that specific place and have the help in navigating the system. So we worked a lot on that and not so much as to relying on getting the information outside of that, but give them a place to go get it. Now we need to move the other. We have listening sessions where the public is invited to come and share on certain topics.
Yeah, I'd like to acknowledge Kimberly. She, through NAMI, through peer-to-peer support, there was a question, an email that actually came to us. And Kimberly was from a potential UC Davis student who suffers from mental illness, but was concerned about, I'm ready to go to college, but what support could I expect? And Kimberly did a great job reaching out and really talking to them as part of NAMI, not his role. But it just goes to show that there are people out there. And so as part of NAMI, we get this all the time where people don't know where to go. So maybe there's a partnership out there between NAMI and this group to create something, whatever this something is.
I know that NAMI does a good job at communicating, that they can't be every place, because I know that we would like to have them over there in West Sacramento. I think we're attempting to try to get them to come to the community center over there that just opened. But like I said, there's not. That would be one of the places that we would have to work on, to have a localized place for the community to come and get the information, that the service.
Or even on a website. I mean, these are very.
Not everybody's on the website, though.
Yeah, I know. I just know that many of the people through the NAMI that I see they're looking for that.
Yeah, I try to get the information out prior to us having our meetings over here on social media, but not everyone's on social media, but that's kind of difficult too. So I think we can do a better job at that, because that's part of communication and education. So, and that's something that the ad hoc committee can work on and see, and maybe work with other services to do it better. Or come up with some other ideas.
Okay, so just someone want to make a motion about changes to the bylaws?
Are we still discussing?
Yeah. We talked about program.
Now, Kimberly, I thought you had your hand up, so I just want to make sure.
Oh, no.
Okay, it's pretty good.
I think the idea of making it instead of a standing committee, but an ad hoc, and trying that to allow the freedom to be able to get more done.
So I don't think we have to have that we will create ad hocs in the bylaws, but we do need to say that we're going to be removing the standing committees.
Yeah, so that's the
And
issue.
so I'll make a motion that we remove the language that I read earlier today. With the understanding that we will be committed and not putting it in language, but we will be committed and put it into our calendar that we will have that. So that,
And so your motion is
to
to
remove the language.
read, yeah, okay.
13 of the bylaws.
What do you want me to get?
It's section 13.
Section 13?
Exactly.
Is that the whole section being?
Yeah, I just cut it out in case.
Okay, that's, just want to make sure.
Yes.
Okay.
I'm sorry, I just want to make sure that the people on the programs, I think that they had an opportunity, but they wanted to keep it to.
Well, it's been
And
more.
make that an ad hoc. Like, I can. make
I
that
would
an ad hoc.
prefer an ad hoc committee
Yeah.
because I think it's less stressful in dealing
Yeah.
with.
Well, today we ran into
Trying
a
to
problem.
schedule, and I sent the agenda to Christina on Friday, thinking it would get posted on Friday, and then she doesn't work on Friday. so
Yeah.
I didn't know it. And so the agenda didn't get posted, so we had to cancel the meeting, which was a problem.
So we we will make these three all ad hocs.
Okay. Yeah,
They'll still continue. We will just not have in the bylaws the three standing committees.
Right, and the information will come back to the board, and at that time, the stakeholders have an opportunity to add input and hear what's going
at the
on.
board meeting.
So before we make this change, I want to understand this, because one of my issues with standing committees was, what are they gonna do? So the language is still reading that the committees are reviewing issues sent to them by the board, correct?
Yes,
So we're just not picking random items to review on our own.
right.
So
So,
how does that fit into what we were just talking about before? Because I'm a little concerned that we still have identified an opportunity. But we don't really have identified way to solve it. So we talked about an ad hoc. So would that still be acceptable with what you just said?
I think so. One of the discussions we had early on was, what was the review of these standing committees, right?
Right.
And everybody had all kinds of ideas. We should look at this and we should look at that. And we should look at our own, look at the new legislative proposals out there. And so one of the discussions was, well, what really do these committees look like? Ad hoc, standing or ad hoc. And the language is pretty clear to me. I read it's pretty clear. In the bylaws was things that were assigned to them.
exactly.
And so we had some differences about that early in.
I mean, the
committees
committees, yes, the committees can suggest,
Anything the board sends to them.
committees can suggest what they'd like to look at, but the directions come from the board.
But the section 15, the chair may anytime appoint and kind of modify the ad hoc committee of the board to address strategic goals, projects, or studies. These committees shall address a specific task, be for a time certain, and will disband upon completion of the assigned task. So that's the language we have for the ad hoc committees. So then, if we modify our bylaws, it would be upon Jonathan as the chair to write up the task for an ad hoc committee. That is almost legal, I think it's forensic, but through with the county council for each of the tasks that we need to have covered.
Do we want to consider whether changing some of that language? I'll just throw this out. Instead of the chair, have the executive committee have the authority to create an ad hoc, or would that matter?
I think that,
I'm okay with it.
I mean, I don't care, but I think the way it's said is the chair is just kind of blessing it and setting it up. It's really the board and the executive committee that's telling the chair, we think we should have this ad hoc committee, or the chair could do it, and then the chair is just the one that kind of appoints, makes it.
We're coming back next month to approve the amended bylaws, but the standing committee section
Is out
will be out.
under this motion.
And then that will also then change the executive committee because the chair for the standing committees is part of the executive committee, so then there'll be a ripple effect in some of this, and
Yeah,
we come
change
back.
that too.
Yeah, so we come back next month, we'll have a proposed bylaws change. And then we can discuss, should it be the chair of the executive committee that should make the appointment.
Right.
That might be the appropriate.
So I'm gonna stop right here. So who made the motion?
I made the motion, but.
Okay. Do we have a second? We're gonna have some discussion. We're gonna have some discussion.
say. what-
Yes.
I make a motion that we remove the language, for the standing committees by bylaws.
And Sue makes a second, so now let's have
Sarah.
Sarah, I'm sorry.
Oh,
So, any discussion on that?
Yes, please. Okay, so if you take Chris's definition, how is an ad hoc committee possibly going to be the programs committee? Because you have to have a specific task, we need to starting that. So if they've got an ongoing committee to review programs, how does that work?
I can't understand.
I was thinking about that while you were talking. And we decided kind of to set a goal of 3 site visits. So if we could do those 3 site visits, then we're done for the year,
So
right?
you're really the site visit ad hoc committee.
Kind of like that, yeah, I would say,
The main function of the program.
yeah.
And if there was something else. it would be
Then
we would do
discussed.
another.
We could do
But I mean-
another
I
committee.
mean, if you as a committee say, these are the site visits we're going to do, you know, these are the projected dates. Then you're done, you know, you let them complete the site visits, you set up the committee, you set up the site visits, you set some dates. You know, so. Brett?
I know this is a little bit off topic. I just wanted to say real fast that I was not upset at anybody in our group. I'm not upset at anybody at all. I just wanted to make sure that the rules were totally clear. So, I don't, I wasn't upset.
It's part of it, I think, just trying to figure out how this would work. So the survey. We're creating the survey. So
That would be,
so couldn't the survey be an ad hoc and your site visits be the program? I mean, just because it's the work, getting work done.
Yes.
The one, right? So
Yes,
couldn't you-
yeah,
Or you have an ad hoc committee to create a
Right,
survey
survey.
and develop 3 site visits, so just do your 24,
Right,
25.
but the program committee can still be standing, because maybe it's reviewing.
but then what
We
would
want
the
it to be-
program, what would the program committee do then?
I mean, you can set
Basically,
up.
that's what we're
You
doing.
can
as
set up,
program
you can
committee.
set up ad hocs for each piece.
Right.
You know, setting them up, doing a survey, you know, for each
Then you
piece.
don't need to stand.
It just makes it very challenging to have standing with.
I'm okay with that if I think we have an ad hoc to get back to, how are we gonna do community outreach? How are we gonna do that? Because I know ad hocs can still be available to the public, but it's not as consistent, right? It's not like. So I just would wanna, make sure we understand.
But we bring,
They
we have an hour, you bring it back. to-
Right, no, I'm just.
But how do we get, how does the community then understand how to work, right? And how
You could have an ad hoc committee to do community outreach,
Yes,
to educate the community, and those could
then
be
I'd be
public
okay with
meetings.
that, because I really feel like we have to be mindful of how do we hear from our community?
Yeah, I agree with that. I think we need to focus on that. And get
That's
back.
what the reason was, not to exalt the standing committees, because if you have a standing committee. I think Nikki was bringing this up, that you would instantly have public, participation.
Yeah, and that's really all I was trying to get at.
And that's all I'm trying to get. Well, honest, I'm totally-
It's so that I don't, so that the chair
Yeah,
doesn't get to be the person everybody calls when they think they've been done
so
wrong.
I think, so I'm feeling like we have to do a better job of public outreach and getting public input.
Yes.
But I don't know if the way to do that is by having standing committees, because honestly, when we have we don't get any public input
We
anyway.
don't.
But that's not the point. The point is to offer that public.
The point is they had the opportunity.
It's not, it's not,
But we
you're not
don't
gonna
need-
judge people and say, wait, there's not enough people
But
here.
we
so
don't
we'll
need a
just-
standing committee to seek input, and it makes it so complicated. We need
You
to
don't need
be,
a standing.
we need to
committee.
be seeking input for.
That's a standing committee is what I understood.
We don't need a
I'm
standing
sorry, I'm totally
committee.
confused.
We don't need a standing committee to seek input. Standing committee requires that you make it public. Well, what I think we should be doing is always seeking public input, working very
Exactly.
closely with NAMI, because they're kind of, I feel, our conduit to the public that's gonna give us input, but we don't have to do that through a standing committee. We're not, you know, in order to get input. And when we do it, we don't get any input anyway. So what I'm saying is, we should be always seeking input, and maybe we have a standing committee to work with NAMI on how we can do a better job, but we don't need standing committees to get public input.
No, I think back to Ray's point, and it's well said, this can be it, but it's not, because we don't get a lot of people coming, you know, and it's. We try, but I mean, so we just have to figure out.
Yeah.
Are we doing the best?
Yes.
A step in the right direction, I think, is because we have it on Zoom, which before when we had COVID, we didn't have a lot of participation, but when we got Zoom,
Oh, sure.
the hybrid, we got more participation. So that's a step in the right direction, but we still got to do better.
Brett?
I just have two thoughts. My first thought is that the public should be presented as much as it can be by us.
Yes.
My second thought is, I don't know what if an ad hoc committee is better than a standing committee, but I'm willing to do whatever the work is out for under the board. So those are my two big ones, public, and I'm willing to do the work with somebody. I don't understand a lot of it.
So
A quick comment.
Yeah.
So I think with regards to standing committees, and you said it around being very strategic to solve problems. Our problem is we don't have enough public participation. I'm not sure that the standing committee solves that, but we do need to do a job of trying to figure something out. And to me, that's the ad hoc. And then we come up with a plan and try to execute it and improve our public.
Yeah.
Exactly.
And
You can always come back.
Right, and if we're not meeting that objective, we can always put together a standing committee to do something.
Correct.
Okay, we have a motion on the table, a second. Does anyone need to do a motion again? All in favor?
Aye.
Opposed? Abstentions? Okay, no, all right. Got that, Chris and Sue?
So we created.
A paragraph,
right?
Yeah.
Now you gotta create an annual.
Do you want to do that now? What are the ad hocs we want to do?
Well, I think just with respect to what Randy.
So you want to do the 3 ad hocs,
No.
what?
We need an ad hoc committee to improve our outreach and come up with strategies. in that area.
That's communication, education.
Yeah.
Well, kind of, yes.
We're taking a slice.
Outreach, an outreach ad hoc.
Yes.
Taking slice.
Okay,
Yeah.
We're starting with the slice.
who wants to be,
For historical purposes.
Maybe in a new. I didn't know what you said, I'm sorry.
okay, outreach ad hoc.
I'm be on it today.
Okay, Brett.
More than a majority.
Yeah. we don't know that now, yes. But,
Wait,
Yeah.
she's having a hard time keeping up with what.
yes, so we have,
We know.
we have Melanie, Kimberly, Sue, Sarah, Brad, John. Meg.
Sarah, Brad, and John?
I'll
No,
do it. I don't.
no, we have Meg, John, Sarah, Sue, Kimberly, and Melanie.
Okay, I got
Sorry,
everyone, except for I didn't get John.
Going back to Joe, maybe we divide this even more, since there's so much interest. So Joe, I don't remember what you said. But you said something with respect to, we talked about how we all respond, what our, I don't think it's goal, or I don't think it's our values mission, but it's all.
No,
make
well,
this
there was something.
consistent.
So one was, I just struggle, one of the things I struggle with is how do I educate my part of the community about
Right.
what the board is discussing, the decisions we make. And do that in a way that's consistent with the way you folks message to your group, so we're getting that message out as a group and not as an individual. And I struggle with that, I struggle paraphrasing what people want to get
Part of
out.
this, maybe we slice it up and say, there's a group that works with that, there's a group that like this, and then we put it together.
So with regards to getting that messaging, I want to say, sort of, I don't understand because it feels to me, I think you guys see the same thing. Mental health is one of the 2 biggest issues in the community that we see, but I don't think people connect that issue with this board. And being able to help make a change with this board. They connect it with calling the police. They connect it with calling board of supervisors and city council.
Right.
They don't understand the role this board can play, and that's really the messaging we need to get out. If this is an issue for you in your community, come to these meetings.
Which is part of
And that-
what we need, right? So the.
Yes, but they don't, nobody I know would say, you know what? There's too many mental health folks running, people with mental health issues running around town. I'm gonna go to the local mental health. They just don't connect with that.
So this, yeah, ad hoc will work on that.
Yes.
Well, but I think you're saying we need two.
I was
Why
thinking
did
divided
that
up into
information?
interests, right?
Right.
And we divided up for there.
So what are you thinking of the
On
two?
the agenda.
What did you say?
Okay, so that out of that.
Give that.
I was saying,
Like the engagement, community engagement, and then education.
Yeah.
That's
Have you seen?
one is how do we engage people, and the other is
How do
what
we
we're.
communicate?
What are we guys?
How
doing?
do we-
I get it,
What-
exactly.
Right.
So
How and what.
do we want to split it up or have that should be later?
What? I don't know, I mean, it just seems like since there's so much interest, let's look at it and we can maybe be more efficient.
Would it be possible to have an initial ad hoc meeting to discuss?
Have a good ad hoc meeting and then come back and tell us what you want to do. All right, so I feel like we should all have one other, at least one other ad hoc, which is the site visit.
Yeah, I think we should.
And
do that.
Sarah, you're gonna chair that.
I can do that.
And who else wants to be on the site visit? Kimberly, Melanie, Brad, Kimberly, Melanie, Brad, and Nikki. With Sarah, this is the site visit. Oh,
I don't, yeah.
you got all that?
Yes.
Yeah, no, nothing, none of these have 8.
And then are you gonna do?
They all, all are under 7, all are under 8. 7 would be
So-
okay, right?
Jonathan, can I clarify what the very first ad hoc committee is going to be called? Outreach. Okay, thank you.
Okay.
I was just gonna say, I'm on outreach, I'm just not totally sure I understand what it's going to.
Put Brad on outreach.
Well, you should have.
Outreach?
community coming.
I have them on site visit. Do you want to on both?
No, Brad's not on site visit.
No, I am on.
He
He
is.
is on site visit.
Yeah, okay.
Site visit and he's on outreach.
Okay.
The 8 yet. I was gonna say outreach session, there was a lot of.
I think I should stay off that.
No,
but I think-
I have
We're not-
Kim, Meg, Sarah, Kimberly, Sue, and John for outreach.
You could have.
Forgot Melanie.
An outreach committee developing a plan.
Melanie and Meg.
Melanie and Meg, thank you.
So that is 8 or is that 7?
I just want to make sure we're under our amount.
Brad just said he wants to stay on the site.
I do understand it's actually.
Okay,
I don't, I would have really wanted to see my outreach.
and that's Kim, Mel, Brad, and Nikki.
But I see it as we're all gonna really be working on this, because this group's gonna bring it back and we're gonna have a discussion about it, so.
Wait, so site visit, I feel like there were more, maybe. Would you have, Christina?
Kim, Mel, Brad, and Nikki.
Anyone else?
So you're not part of the.
Sarah's the chair.
Sarah, okay.
All right.
Lots to keep up with. You're doing a great job.
Okay, we're gonna move on.
But I do have some ideas that I've.
Oh, we have some, well, no, that's Samantha. That's Sam, okay. Do we have any public comments on what's been discussed?
Before I'm on outreach, I also forget, I'm sure exactly what outreach.
Excuse me, thank you.
Outreach.
So you'll go, you'll
1, 2, 3, 4, 5, 6.
go to the meeting and then the.
Okay.
All right.
I wanted to do.
Any public comment?
I don't,
One more thing, are we gonna do separate one survey, or a survey for? It's gonna be all part of it.
That'll be later.
I have a question.
Can't be with
Yeah.
that without-
Don't the ad hoc committees have to be less than a majority
Yeah,
of your,
okay.
isn't that 9 for the
Yeah.
outreach?
It needs to be set, it cannot be 8, it has to be 7
can
or
take
less.
Okay, maybe I doubled. You're fine, you're fine.
We're fine. I don't think any are at 8.
Sarah,
My idea
okay.
for this ad hoc committee is that a smaller number of individuals as opposed to a larger ad hoc committee would be more efficient. So if we try to come up with an outreach plan, having a smaller group come up with a plan, present it to us, and then implementing that plan, go talk to your city council and tell them what you're doing in the local mental health board, go to a Rotary Club meeting. Do that engagement piece, to come up with that plan, and then task people to go and do certain engagement things, might be more efficient than having 7 or 8 people meeting. And everyone trying to communicate.
I think we should drop off and look at, we don't have so many people that will be active on it, so we guys. Okay, any public comment?
Where are you going?
No public comment, all right.
No, I'm sorry, I have one last, so the survey.
Oh, go that way.
And then feedback, so
Yeah.
I'm not gonna be on the outreach committee ad hoc, but how are you gonna get feedback on the survey? Because you have to have a survey before you can say.
Well, I thought the ad hoc committee will meet together, we'll discuss it, we'll come up with a
Okay, should
A draft?
Give her.
We were gonna come up,
Yeah.
we would come up with the draft and we'd bring the draft back to the board and the
Yeah.
board would look at it and decide. And then.
Yeah.
All right, I'm gonna move on.
John, under existing bylaw.
Yeah, no.
Who wants to do this?
Yeah, no, I want your
Point,
feedback.
vote on it.
That's Samantha from, that's our Sam,
Yes.
Harley.
Yeah.
One technical thing to be careful, minute should reflect the purpose of each, and that they're to come back to the board, ideally. Recommendation.
And who's the chair of that one?
So Christina, you have the purpose of each ad hoc.
I do not. Have you stated one?
Maybe
It should be during your meeting, right?
instead of doing here, just write out what they are and sign it. You have your,
Yeah, I don't need to do it at a meeting.
write it out.
It has to be somewhere written out.
Okay,
So write out the appointment.
okay. All right, we're on the consent agenda, mental health director's report. What items do we want?
Okay.
Pulled? Maria, say.
Yeah, okay.
A. I'm gonna pull E.
C.
C, okay.
I was gonna vote you also.
And, anything else?
Everything got pulled, but the,
D, did D get pulled? Who pulled D?
so, no, okay.
Did someone pull D?
I just heard A, E, and C.
Same, so.
Thought I heard you said-
Okay, A and C.
Can I add B?
B.
B.
Okay, let's start off, we can add, if someone wants to pull B, they can. So we'll start off with A, Maria.
So my specific question was in the therapy for foster care.
Yeah.
RFP, that's gonna be released for RFP, but are you going to ask for volunteers?
Yeah, we'll reach out to see, yeah.
Okay.
Mhm.
And
I
then
just, and I'll just give a heads up on that one. So therapeutic foster care is a really tricky benefit. I will say we're in the middle of our audit, you know, our big triennial audit started this week. And in our children's section, they've asked lots of questions about that benefit. We're gonna gather some data statewide, but you know, for example, Sacramento County, the last data we heard, they have 4 therapeutic foster care homes in the entire county, and they have a population of 1.5 million. So, you know, for somewhere like Yolo County with 200,000, the potential of us having therapeutic foster care is really slim to none. It's I have a lot of opinions about it. I'll probably spare you all from my soapbox, but it was a pretty poorly designed benefit from DHCS. And so if there's some really inherent problems with the model, nonetheless, we're required to arrange for it if there's a medical member who meets criteria for it. And so we will issue the RFP. I am not hopeful that we'll get bids, so we certainly will reach out. And we would welcome participation on the panel. Yeah.
Isn't this what Families First used to do?
No, therapeutic foster care is brand new. We've
Oh.
never had it in Yolo County. It was a new benefit several years ago. But essentially what therapeutic foster care is it says if a child meets a certain threshold of having mental health needs and a certain level of care, they would be able to go into what's called a therapeutic foster care home where the foster parent is supposed to have some sort of enhanced training. And that the foster parent builds Medi-Cal, like they're providing services.
As a therapist.
Yeah, like as not a therapist, but yeah, as like a provider. Which most foster family agencies are not willing to take on the risk of that because, and
Potential liability.
Yeah,
And they're not licensed.
there's also no funding for the board of care costs of actually placing a child there unless they're in foster care already. So it's, there's a lot of challenges inherent in the actual benefit. Because that the rate that DHS originally had created for it was like $83 a day or something. It was like, anyway, so, but I think we're on track to have the RFP issued at the end of this month, so what we usually do is reach out to Jonathan. And ask that he reach out to the board to identify someone to participate. $3 a day? It was something like that, because it was like a bundled rate and they could only bill once per day. And the rate was like $83, so counties that did implement early on were having to supplement with county general funds taxes because the foster parents were saying this isn't enough.
It doesn't make enough, it doesn't make any sense.
No, and that's the problem.
Yeah, okay.
So, yeah.
Okay, B,
So that was,
Yeah.
I see that, the budget is coming up for presentation in May, so those are your proposals. Is that gonna come back in some format to us?
Yeah, I think it will. I don't exactly know what the format's gonna be for this, and so the agenda's not posted yet. I just know that there's a county budget presentation happening that day.
Right.
It's my understanding that HHSA will also have a separate fiscal presentation that day, and then I can work with our fiscal team to bring a presentation back.
that'll be for the board of supervisors meeting in June.
Yeah.
Right?
Yeah.
Oh, no,
Will it have to be the next meeting because they're.
yes, yeah, okay, all right, Meg, crisis continuum updates, what are your questions for?
Just a question on the High Tech Health Center, so the transition has gone well. I'm just curious. What's our metric to know it's gone well, I guess?
Well, we didn't have any issues with the conversion of the calls going from one agency to another. We've had the same organization running our 24-hour access and crisis lines for many years. And so I was quite nervous, right? Just even about the transfer over of the calls on the day of the transfer, right? But that part went seamlessly, so there was no issues with the call transfer. I think, in terms of the ongoing opportunities, the new provider needs to learn our system, they need to learn our teams, our processes. So there's a learning curve, and we're gonna do some more ongoing training with them to orient them to our systems, but they're getting into our electronic health record. And they're getting to know our mobile crisis process. So I think considering that it just launched at the end of March, I think we're making good progress so far, since considering it's been barely a month, that since we've launched. But just that initial, okay, the call line is switched over, we were all sort of like holding our breath and crossing our fingers, and that part went fine, which was a big sign of it. Yeah.
All right, partnership, health and dignity, so, I made a public comment at the last board of supervisors meeting. There was a lot of strong feelings on behalf of almost all our members of the board of supervisors about, significant issues with this contract being not being renewed, and the 17,000 Yolo County residents that all are losing their all their doctors aside from their mental health providers, their psychiatrists. That's a different system, different one, I don't know the proper word. One of the most vocal, which I appreciated, was Menza on this issue. And maybe you can give us just an update as to any progress. I know that Nolan, our director of health and human services, sits on the board of the partnership.
Yeah.
Is there an update? And then maybe Supervisor Menza might share his thoughts or input.
Yeah, so, yeah, I can certainly start with an update. So on April 26th, partnership sent a new proposal to Dignity Common Spirit, so we don't know anything more than that, just that a new proposal was sent. I think there's been a lot of differing information in the media, right, about whether or not negotiations have been ongoing. Partnership has said that they have been, Dignity has said that it hasn't been, so it's been, I think, a bit tense. But it sounds like partnership sent a new proposal over. As you probably have seen, like I said in my update, our board sent over a letter requesting state mediation. So it looks like staff initiated contact with partnership requesting an update on the state mediation process this week. We are talking to continue to work with local providers to assist patients being reassigned. So I do have an update on that. So 10,000 patients have been assigned to Communicare Olay for primary care. And those are members across the county. So I know that about 4,000 of those members reside in West Sacramento. And then when I have it in a text message. About a little over 3,000 of those members reside in Woodland, and nearly 3,000 of those members would be getting their services in Davis. So it's fairly equally split in the 3 major cities in the county. I believe Winters Healthcare is also being reassigned some patients, but a much smaller number. And some of the smaller federally qualified healthcare centers are assessing their ability to take on some patients. So however, Communicare also has some pretty significant state issues, with taking on that many new patients at one time. So I think they're really trying to ramp up their own services in order to take in that kind of an influx. Our health officer, Dr. Sisson, is working with the medical directors at Partnership. And then with our providers also to assist with transition issues at any level that she can, and to stay connected there. And then we're continuing to support community members as they call in for support or experiencing issues with transition. And we're escalating issues as they come to us. And in my update, I provided some information about behavioral health, because that is a bit separate from the medical care. So I wanted to make sure that folks here knew, as we clarified with Partnership, that Dignity does provide some mild to moderate behavioral health services. And those services are not affected by this contractual issue, because those occur through a separate contract with Carelon as sort of the third, party for the behavioral health services. Those services are not disrupted as part of this contract expiration. But it is medical care and specialty care, which is a significant disruption.
So that means we don't lose access to 3B.
No, we don't lose access to 3B, nor that's also emergency care. I mean, that's a bit different, right? So it's like primary care and specialty care that's really impacted, and then those, so I think that's really what's impacted here.
I'm sorry, is it only, the Dignity hospitals that are having this issue with Medi-Cal? Partnership, because I actually have a partnership.
Partnership, actually, Dignity failed to execute a new contract with both Partnership and Aetna, but then they did resolve contractual issues with Aetna, and they did execute a new contract with Aetna. So the issue is only outstanding with Partnership.
So is it the medical group or the hospital or both?
It's the medical group.
So yeah, that makes more sense.
Yeah.
Okay. Yeah, because
So I'm confused as to how does some of them have Aetna and some of them have?
That's not Partnership. No, that has nothing to do with, no. That has nothing to do with Partnership. I was just sharing, Dignity actually had multiple contractual issues, not just with Partnership. So I'm not sure how, there's some media coverage, that Dignity had some sort of an agreement or some kind of an order where their rates were locked in until a certain date. And when that expired, then they requested rate increases across, I think, many contracts. And so they then failed to reach an agreement with 2 separate contracts, one with Partnership,
Right.
one with Aetna as a separate health clinic. And both, I think, contracts expired.
Right.
They have continued to negotiate.
Yeah.
They still failed to come to an agreement with, they've still failed to come to an agreement with Partnership. They did come to an agreement with Aetna. So that is a
Well,
separate.
so I can tell you that my son somehow switched to Aetna. Like, I don't even know how that happened. Just all of a sudden it was Aetna. He got the letters done. I've never seen anything saying, oh, no, you're back in play because you're with Aetna. We made an agreement. I've only seen the letter saying. And so, and to switch to Aetna, I don't even know how it happened. All of a sudden he was Partnership and then he was Aetna. So he's Aetna now,
Maybe he has Aetna through partnership, so maybe that's different than the
so there's
contract.
Aetna through Aetna and Aetna through partnership.
Yeah.
Yes.
Just like there used to be Kaiser through Medi-Cal and then there's Kaiser through Kaiser. They're separate health plans. So I think the Aetna that you're talking about is different than the Aetna that
And the
pays.
private are.
Yes. There's like private Aetna through the commercial insurance. Yeah.
Yeah, well, and so I can also tell you that the impact, like yellow is bad, but like as we go up north, where it's a higher percentage, like Shasta County
Yeah.
is really bad. So there's a guy that's working on an op-ed piece that's been talking to me, that he wants to get in B and stuff. And the folks in Shasta, they have to travel like miles and miles and miles and miles to see their new doctors, you know? It's not quite as challenging in YOLO where you can go to Communicare maybe,
Yeah.
but it's, anyway.
It's still quite disruptive, right? For folks.
It sounds
Yes, it is a terrible situation.
I'm wondering, if somebody, mental health contract is still there separately, but if somebody loses their primary care doctor and whose relationship with the primary care that got them to the mental health professional, is there a problem there?
No, yeah, it's separate. So the way that it works with partnership with managed care is that there's a screening process for mental health where they determine whether they meet the mild to moderate criteria or if they need specialty mental health, and then that comes to us, right, as the mental health plan. And so the mild to moderate, that goes through Carelon, and then that's when they select a provider. So that can happen entirely separately through their care. So they could certainly they could have been getting their primary care through Dignity and then their behavioral health through the Dignity providers, but even though they've lost the medical care, we've been assured they can continue to get their behavioral health services. But it's not ideal, right? Because that should be happening.
Well, what I also read is if you had an ongoing issue with a non-mental health professional, that you could continue with your doctor of dignity.
But they would have to take the rate.
Yeah.
They would have to agree to accept the rate, and
Yeah.
that's
There's no
the point of
difference in-
contention. So I think that people were probably not able to actually get those services because that was the caveat.
Yeah,
They
and so,
could.
and so what,
Yeah, and that was during the-
so this reporter who's really into this stuff, like, I don't know what his, if he has personal or, but what he's telling me is that Dignity, when they combined with, what was the?
Common Spirit.
They agreed with the Attorney General, who was at time now our Senator, Becerra, to take Medi-Cal patients for 5 years. That was part of the agreement in order to combine forces. And as soon as the 5 years
Yeah,
ended,
that's what it was.
they're like, we're done.
Well, they got them the rate. I mean, they requested.
Yeah, we're like, we're no longer doing it for that rate.
The negotiation is kind of interesting because I met with Dignity and asked them about it, and I'll send emails. to them. Here's our proposal, and a couple of weeks later, and something comes from the other side. And that's not my idea of negotiation. My idea is you're sitting across the table,
Yeah.
going through a list of issues and trying to come to an agreement that would impact on patients. And the county did write, in addition to writing to the partnership and Dignity, also wrote to the state requesting that they appoint a mediator, and we got a short letter back saying that that's what we do, we'd love to do it, but the parties have to request it. So apparently neither Dignity nor partnership has actually requested that service from the state.
Well, but why isn't partnership? I mean, I understand why Dignity isn't, because they don't want these. Like, they're doing the stuff with the emails, because they just want to check boxes that we tried, so they can make it look for optics like we tried, even though they aren't. That's my opinion.
Well, they tell me that they really want to do it. In fact, they need to do it because it's part of their.
Right.
Yeah.
Part of their outreach or their,
Part of their. There's so many patients that
Yeah.
hurt them not to do it. And so it's kind of a disconnect. If
Well-
both partnership and Dignity want to do it, why are they just sending emails to them?
but so like, we have our Director of Health and Human Services, right? he works for you. And he's on the board of partnership. So why isn't partnership asking for that? That's a rhetorical question.
Well, we talked about that this morning. We presented to the agent once. Good work.
Okay, thank you. Thanks for your help on this.
But there were, the medical billing and the rates are all very complex. They both partnership and dignity have their various views. I can't claim to understand that portion of it. I am sympathetic to the argument that, and I do believe that dignity was affected by being owned by this common
Yeah,
spirit.
yeah.
It just seems that they have to go through a bureaucracy even more than they used to have to.
Sure.
Before to make any financial decision. Their loss
Yeah.
is based on.
And it's physicians, right? This is the medical groups. These are the physicians saying we can't afford to practice. So it's not, it's also medical groups are separate from hospital, right? California. So it's also the physicians. So there should be some way to be someone reaching out to physicians to figure out who that is, right? Because it's all.
That's what a good mediator with background in that can do, is narrow down the issues, force people to discuss. I want to be in a room all day until they help if I have someone.
Because Dignity is a hospital will suffer because they won't have patients in their hospital where
Coming
they make their
in.
money.
Right.
But the physicians can't afford to provide the services for that. So they all need to come to.
Except for billings.
Yeah. Exactly.
Okay.
As was Carly, did I, was that accurate? Did I miss anything?
No, I don't.
Anything else? All right.
That's okay.
I'm gonna go to the restroom. Maria's gonna take this minute.
Okay, for our next agenda item. Let's get this up. We have the board of supervisors.
No, Stan, I think we still have Stan.
Oh, okay, so we do want an update from the standing committees, just as they existed for our last. So Joe, you have an update?
Yeah, the update is we have refrained from holding a budget committee to resolve our issues here. Looks like we did right to hit it.
Check the box.
And she is not here for communications and education, but I know that we have not had any meetings. Why don't you, you or Kimberly? There's been
One thing I seen was that she talked to us about creating a mission statement and had provided, I think, a example, and then I think Carly sent something back that said we already had one, and you sent it to her for us to read, and I'm thinking, I asked a few questions about that too earlier, that I don't think we have to reinvent a wheel. I think we just need to look to see if we're meeting the standards of our mission statement for local mental health. Just thinking ahead to that.
I don't even.
Yeah,
bring it to you at the beginning of the vote. So this was on the last set of the bylaws, so I don't know if it's in this one, but Carlene just shared it with us. So it says Yolo County Local Mental Health Board supports the wellness, recovery, and resilience of all Yolo County residents through the identification of local mental health assets and needs, informed advocacy and education, and collaboration with policymakers, service providers, consumers, and family members. Our values are that every person deserves well-being and quality of life. Every person has value, importance, and is unique. Meaningful consumer and family participation. Cultural sensitivity, appropriateness, and appreciation for the diversity of the region. Highest quality integrated services and supports. Strong social safety net, political and personal accountability, advocacy beyond the minimum mandated care, and evaluation and evidence-based decision making.
Take a look at that. It's inventory to see if we're meeting that. You can say we're not, because we're having a problem, like you said, with the communication. So I think that's where we're working at, is to improve, make sure that we're doing it. We discussed it. And we remove some of the obstacles, I think, that prevent us from moving forward and taking more action on that to make it work better by creating the ad hoc instead of a standing committee. So still processing, we're still in process of doing. We haven't gotten together, I think, as an ad hoc committee but we did get everybody, that volunteered to work on that, to see if we are meeting those standards of the mission statement. Or we can improve. It's not all bad. Yeah, anybody else?
All right,
But Sue, were you on the education too?
no,
Only very brief.
all right, program,
Well, we didn't meet today. We're looking at. I sent out a, questionnaire that we were gonna look at that's from Sacramento, I think it's from San Francisco County. It was on the website, it's now, for the website, and we're just gonna make recommendations. We need about what we want to include in the parent, an anonymous client survey.
I know that was on the website, I guess. My question is, it seems like there might be some questions on there that should be legal, should put an eye on. I don't know how that works, because I don't know how that works, like, does the county,
I think they were working with Carlene initially, right?
I'm sorry, can you repeat that?
We haven't approached Carlene yet
we're still just, yeah.
On the survey for the site.
for the
Questionnaire.
for the clients. So we were just looking at what we thought might be appropriate questions, and then we would notify her.
Yeah, we do a client consumer perception survey, but it's system wide.
Oh, okay.
And that's one of the things that we'll bring back to this group, right? The results of that. But,
Yeah,
you know, I think you're talking about whether or not different client feedback on the site.
yes, I understand.
Yeah,
Yeah, okay.
I think we,
I just didn't know. Yeah, if there was a mechanism for that, so. Thank you.
Yeah, I think that Carlene's gonna look at it, and then if there are questions, like from a legal standpoint, we can have someone else, have county council look at it or something.
yeah, I mean, yeah, we can do some follow. I mean, who should we want to point of contact to discuss it with?
Probably
Sarah, okay, and then maybe I'll reach out to you over email, and we can set up some time to talk. I mean, I think. Yeah, you know, I mean, I think
Yeah,
there's some
that's
concerns
fine.
we have to talk through, yeah. I'll send you an
We already have approved some, or we have some site documents that we, the board have looked at. They're still in draft form. We have to finish that up. And then we'll make decisions about where. the tree sites have been.
I don't know if I could ask Sarah a question.
Sure.
So since we didn't meet today, are we gonna meet again before the next? What I mean is not the hour before the meeting. What
No,
I'm saying is between now and the next meeting, are we
I
gonna
would
make
like-
up for tonight?
I would like to.
So,
Okay. We can talk about that.
Can't wait.
Yeah.
We're gonna be in that.
You do see that.
oh, that'd be cool. That'd be easy.
Yeah, we could do that.
We should be able to have it. That's nice.
All right. Board of
Say what?
Supervisors report.
We all have the surveys.
Yeah, I've sent it out to them.
Just a brief report. The board went back to Washington DC on the capital trip. And one of the things that Sheriff Burks and I did was to meet with legislators and ask for support funding for Crisis Now. We're about $2 million short, and the specific request is for the building, for the crisis receiving center. Between the cities, the county, the hospital system, we have money to do the other aspects of the program. The actual building, we're short. So we're on, it's essentially an what used to be called an earmark, but I guess.
They can't call it that.
Yeah, so I don't know what the new term is, but they all get a little bit of money spread around. So we met with Senator for the Congressman Mike Thompson, Congresswoman Doris Matsui, and also Alfonso Butler. I wasn't in that last week, but the the response was very favorable. And I don't know if as part of the original request, anything was included from this board. But the chair or somebody else wanted to, we have the addresses that we wrote to, so we can read simple things, say, hey, this is important. Our program in reality.
So is that something?
And then we have a phone call with Diaz, expert on mental health, his staff person assigned to mental health issues. And I think it's this week that we have that call to try to get nailed down some sort of commitment to get it. And you may have received a request to participate where I think it went to Nolan.
Not Nolan, yeah.
But somebody.
Yeah.
We've had some staffers on the call in case they ask a question that we don't know the answer to them.
Yeah.
What's the timeline on the Crisis Now funding now?
It's not clear to me because this is a process that they go through. And like last year, we went through it and Congressman Thompson said, yeah, here's some money for the library in that case. So it, as I recall, it was sometime in the summer, but there, because of the way the budget process is working or not working in DC, the actual dates are pretty unclear.
The checks in the mail.
Then we ultimately got a really big check. It's a big cardboard check.
But everybody has to play games with it first.
Yeah.
I was just gonna ask, like, not gonna be on your email, how confident do you feel, how confident it happen?
Well, I
It's
think,
very exciting news to hear.
I think there's a pretty good chance, maybe not, at the Senate level, because the US Senate gets requests from all over the state, but our own Congress members, and we only made one request as a county, we didn't request from all. Because I think the chances of at least one or maybe both. To get somebody to the line, right?
Is there a backup plan?
If there is.
They-
always backup.
I was thinking similarly.
Yeah, we'll figure it out.
Yeah. What would we do as? Obviously, tech and support that request. Yeah.
So this was, given that it was just one request from the county, I think it was.
Can we go rogue individually and send emails requesting things?
Yeah.
Like I'm the kind of person, I go rogue and I talk to, send emails to senators all the time.
Yeah.
Okay, yeah, yeah, let's do it. Go.
Yeah, and send out the names and I have the actual address with like snail mail, but we can get,
These days, emails are just.
Yeah.
All right, Chris, criminal justice.
Here we had today's my home court graduation. I saw some friendly faces in the back there. There'll be more of those. So I can give the dates. We will also have mental health diversion, which is a different program that will have graduations also. Those will be generally on Wednesdays at 10 or 10:30, depending on how many graduates. The next 3 months, there are going to be 11 graduates. And I will tell you that we have one participant who likes to bake cookies, so she makes incredible cookies. So on top of the pizza, it'll be really good cookies. I'm not going to miss one of those for quite some time. I'm going to do the cookies, but
that's a lot of them.
it is. It's a significant number. It's a newer program, the newest program we have. And we're using Communicare for the services. It's probably less intense than mental health court and AIC as far as the severity of the illness or addiction or the duration of time during the program. But it's trained to be very effective. And so
Make sure keeping people from getting to the advanced.
we're trying to, and we also, we are leveling up. A couple of people are trying to, they're not being successful, and they may need a higher level of care. And so we're doing assessments to get that, try and get people into the right program. Okay, I'm gonna take a few minutes, as a lawyer, I can talk for a while, but we do have a new Prop 47 grant cohort 4, where the application is due June 10th. As you may know, I have talked about two other property zone grants. The county has one with HHSA, one with the DA's office. So we're not eligible to apply, but the probation department is taking the lead for a cohort 4. And the grants have changed a little bit. In the previous 3 cohorts, the small grants were $1 million and large grants are $6 million. And for this cohort, the small grants are $2 million and the large ones are $8 million. And there's $60 million for the small grants, which are $2 million, so that's 30 grants. And what we've seen, as I've seen in the last 2 cohorts for the smaller grants, we never had enough applicants that use up all that money, so it got rolled over to the larger grants. So if you made the minimum threshold, you got funded. But the probation department is going after one of the smaller grants. And one of the things that we're trying to develop is a youth court. And so the grant might be used to fund that. There's also, at one point, there was a transitions of care program. There was a reentry program for individuals that coming out of custody that have mental health or addiction issues. And they had a clinician, 1 or 2 case managers that would work to get them connected with treatment. And so what the probation department is looking at, and this is a great opportunity to get feedback to them about what we'd like to see in this grant, because this is part of the kind of helping with the outreach to get the word out, is what that grant should look like. There is an email, if anyone's interested in commenting on the grant, which is prop47@yolocounty.org. And that input will be collected, they'll take a look at it. And it could very well be a combination reentry, getting someone out of custody and maybe supporting the youth court with funds. The Prop 47 is one of those grants where they can't actually pay for housing, which a lot of other grants won't pay for. So that's in the development now. And since it's twice as much as the previous small grant, there's a lot more opportunity. And one of the things that we're getting feedback from Communicare on connections to care grants, we don't have an assigned probation officer, which I think is really important to work with. They had one for the previous Prop 47 grant we had, and they have one in the mental health diversion program. It was 11 graduates. There was a probation officer assigned for that population, working hand in hand with treatment providers and case managers. So that is something they may be looking at. In the budget year next year, we have some deficits, so funding is going to be a challenge, and so getting to be really important. And it may be nice to have a member from this board on their steering committee. They're going for a youth grant. I have one person in mind, and I'm trying to recruit maybe.
Is that young adults? No, no, I thought they had the CCP.
There is some CCP funding. I think, don't we ever have enough funding for that type of program? And we might be able to link the two with reentry with those services in support of individuals in the young adult court or youth court. With the CCP funding, there's a leveraging way to make it get more points towards the grant. So that's a lot of different ideas right now on that. So feedback or ideas on that are being solicited. Some agent of the probation department, some ways for that. But these grants, they're collaborative with all the different county agencies trying to work together to come up so they can be successful. There's a lot of work writing these things and doing community outreach and all that. So.
And you said you'd send the dates for the other.
I will. What I'll do is I can kind of do a monthly, here's what's going to be, then we can be sent up. And I'm not sure the exact dates for the mental health diversion graduation yet. I think they've set those yet. And there is another mental health court graduation will be occurring. Our next time or later this month. So I'll get that one out. And so, and then we did have our addiction intervention for individual had to relapse and passed away. So it's not including this beautiful programs or challenges in our people working on programs. Doing that, that's it. It's very frustrating, to have success and some unsuccessful.
Yeah, I was getting at that, so there was a graduation fantasy last week and I went. And they were talking about one of the participants who was acting as a peer support for the newer participants. He actually, and I watched this gentleman go into the holding cell, because oftentimes the new participants are not yet out of custody until they get into the program. He went into the holding cell to talk to the new participant. And then I talked to him after about like maybe generating some publicity, like try to get funding and things like that. And he said, yeah, I'm totally down with that, you know? That's the guy that died of an overdose. That was just last week.
I think at least 10 months clean, so it's, you know, we're looking at, you know, the Mental Health Service Act, and we're not just gonna be a mental health board, we're gonna be a behavioral health board, and dealing with addiction issues too. So I think we need to be aware of those challenges. And this isn't the first time this has happened. One of these programs has happened before, unfortunately, to the realities that we're dealing with is overdoses and deaths. And it's not just criminal justice, it's all these other people, family members that we're gonna have to expand our knowledge on this going forward. So. But trying to end on a positive note, that was a great graduation of colors and that when we're looking at these populations, it's each individual success that makes these programs worthwhile. And we had our second graduate came to the mental health diversion, taught from the mental health court, and he graduated, let's say in 2015. And he talked about how last week he was 10 years clean, employed, productive. And so that's one of those positive ones. You kind of, this is what makes it all worthwhile.
Yeah.
So, front end positive.
Good, thank you. All right. Any public comment? You're all we got.
I know.
How about Saturday?
About Saturday?
Surround County.
It's,
Sammy Watts.
yeah.
Oh,
Yeah.
What is that?
actually, I don't have much information on that. Yeah, that's the.
California Navy.
So we split off from the Sacramento Walk to start our own, to keep all the money local in yellow.
Oh, is that it? That's Sacramento,
Yeah.
not state.
Right.
That's Sacramento.
Yeah, and they invite neighboring, smaller
Right.
affiliates to join them.
Right, got it.
So, yeah, I forgot that it was Saturday.
Yeah, okay.
People might go and I'm not.
So, I don't know about NAMI, but the collaborative courts group.
What I tried to do with our collaborative course group is to focus on the Yolo County non-walk in September.
Yeah.
So to have a bigger showing, because we will have some people at the Sacramento one. But we are trying to refocus in support of Yolo and
For sure.
and getting out there in numbers. And so that's something I put out at our health court meetings.
Yeah, for sure.
To try and be supportive in that way.
When we participate in the Sacramento one, 40% of all the dollars we raise goes directly to
Yeah.
Sacramento, so,
Well, I've gone to the Sacramento and all I do is walk and then I throw my money
It's perfect.
into Yolo.
It is, the Sacramento one, it still is, I mean, it is a really, really great
Yeah.
event.
Yeah,
I
it's
do
nice.
encourage people to go, because it's really big and it just, you know, there is that sense of community that you get from being around people who really get it, and that you don't have to explain, or you don't have to have people wonder, right? Like, that community that you get from everyone coming together, I just think is really powerful, so, so don't hold against me that I'm not going,
You go, you can get a really cool $100 picture.
right, exactly.
I've got a lot of those.
All right, so our next meeting is in Woodland.
Yes, it is.
June 10th. Thank you, everybody.
If you're exiting, please exit out this door unless you need to go to the restroom, but don't exit out the double doors because the building's already closed.
Which door?
Just this door.
The lights are closed.
The restroom's open if you still need to go, just don't exit out their sliding doors. Unless they open for you, then go ahead.
What do we need to do?
Do it. Oh, I'm just squishing them together and moving these extra ones out of the way. They stay where they're at. Thank you.
Oh, Jen, yeah, oh, yeah, that's probably, yeah, I'm sure it was Jen. Oh, okay.